Uh, in this section, we must explain systemic mycosis. What is systemic mycosis? The infection that spread to more than one organ, internal organ, more than one internal organ. Systemic mycosis may have two agents, pathogenic agent, opportunistic agent. We have two types in relation to pathogenicity of fungi. Some of fungi are pathogenic fungi, true pathogenic fungi. Some of them are opportunistic pathogenic fungi. The opportunistic fungi for make infection need to predisposing factor, the condition that lead to weakness. For example, immunodeficiency, immunocompromised condition. Each condition that lead to weakness of body is predisposing factor for opportunistic fungi. But in pathogenic fungi, there isn't any predisposing factor because they are true pathogen. We have two types of systemic mycosis: pathogenic mycosis, opportunistic mycosis. The pathogenic mycosis don't need to predisposing factor, but the opportunistic mycosis need to condition that lead to weakness. In systemic mycosis, we have 4 infections, but we cannot describe for you. If you like to have some information about this infection, you can read the reference, the Topley-Wilson, that I think mentioned at the last slide. We have four pathogenic systemic mycosis, include histoplasmosis, coccidioidomycosis, paracoccidioidomycosis, and blastomycosis. These infections, these fungi are dimorphic fungi. They are dimorphic fungi. In out of body are mycelial, and when transfer to body change to yeast and the other structure, not only yeast and the other structure. But this pathogenic systemic mycosis are limited to some country, for example, Africa and South America. You find this infection in South America and Africa. And usually there isn't this infection in Middle East. But opportunistic mycosis have this worldwide distribution. You can find in each country, also in your country. We have 4 diseases: Candidiasis, cryptococcosis, aspergillosis, and mucormycosis, because these infections are important in frequency, in mortality rate. Mortality mean death. Mortality rate, high mortality rate in some condition. We must know this infection. Candidiasis and cryptococcosis have yeast fungi as etiologic agent, but aspergillosis and mucormycosis are mycelial fungi as an etiologic agent. Uh, they have worldwide distribution. One of the most common infection is candidiasis. Cryptococcosis is important uh, because it is a dangerous infection and involve brain and lead to death. Aspergillosis usually is in the respiratory infection, lung infection, and mucormycosis is an important infection that occur in some condition like as diabetes and may to death because the infection can spread to brain and show high mortality rate, and it is dangerous in brain type. At first, we must speak about candidiasis. Candidiasis is an infection that agent is a yeast. The genus is Candida. It has more than about uh, 700 species. The main species is Candida albicans, and the other Candida glabrata, tropicalis, cruzi. It is an opportunistic mycosis. Candida is a yeast and it is normal flora on skin and mucous membrane. Do you know what mean normal flora? Normal flora. When we tell some organism is normal flora, what mean? Uh, if you have a microorganism, for example, candida, in surface of skin or surface of mucous membrane, internal organ, sometimes, if you find it sometimes in body, it is normal flora. And when the condition change, for example, immunodepression occurred, this normal flora change to pathogenic form. This microorganism change to pathogenic form. In normal flora, you can find in healthy body. One of them, Candida albicans, as a normal flora in skin. Your weak is any? Yes, yes. I describe. I describe. Uh, at first, you must normal flora what is, and after that, they explain. Normal flora means you find microorganism in body in healthy condition, but change to pathogenic form when acquire immunodeficiency, weakness, it changed to pathogen. Another question, what is mucous membrane? What is mucous membrane? You find candida in the skin. What is mucous membrane? Yes, 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 yes. We have some organ, internal organ, like as respiratory system, urogenital, GI tract. The epithelial layer of this tubular organ is mucous membrane, epithelial of this organ. You can find this normal flora, candida, on a skin and epithelial of GI tract, respiratory system, and urogenital. You can find it normally. But when the body go to weakness in each way, anyway, this microorganism as opportunistic agent start to disease, start to infection, reproduction, and produce metabolite and lead to infection, to mycotic infection. It is a colony of Candida. Candida is dimorphic fungi because it can produce pseudohive or false hive or hyphae kazeb. This is hyphae kazeb. This is yes form and this is hive kazeb, pseudo hive. In pathogenicity, in pathogenic form of candida in body, like as media, make pseudohive. And when we find pseudohive in tissue material, the diagnosis is infection, candidiasis. Candidiasis, the name of infection. We can use the name of fungi plus SIS, candidiasis. It is an scan uh, aspect of yeast as candida. It has a body, it has budding that lead to pseudohive. As I told you before, when you find pseudohive and pseudomycelium in tissue material of a patient, the infection involves the organ, the tissue. We can decide for candidiasis. You find pseudomycelium in tissue material. Or in this picture, this is hive kazeb, pseudohive, false hive, or false mycelium, and blastospore. Blastospore means cell that produce budding, budding with mother cell, blastospore. Blastospore plus pseudohive detect, identify the infection, identify that we have a patient with candidiasis. Or in this picture, you find pseudohive and blastospore. When you find pseudohive, means candidiasis. It is a way, it is a key for diagnosis of infection, diagnosis of mycotic infection or candidiasis. In Clinical manifestation, uh, we have three type of infection: cutaneous candidiasis, mucosal candidiasis, and systemic candidiasis. Candida for change the uh, living in body from saprophytic opportunistic form to pathogenic form needs some condition. One of them, all condition lead to immunodeficiency, all of them, weakness. Some condition is uh, involvement of some disease. For example, diabetes. For example, bacterial infection, bacterial disease. Some of condition, they are this condition. Another condition that lead candida change to pathogenic form is is used and affect iatrogenic factor. What is the iatrogenic factor? They are some physical, medical action, use of antibiotic therapy, use of corticosteroid therapy. The surgery, like as bone, like as solid transplantation. Do you know solid transplantation? Yes or not? Transplantation. For transplantation, you need immunocompromised, immunosuppress the immune system. In this situation, the candida change to pathogenic form. Or in some infection like as HIV, AIDS, it is another condition. In some condition, there isn't any pathogenic form, pathogenic condition. It is physiological factor, like as pregnancy in women. In pregnancy, may you find patient female with candidiasis in urogenital system or respiratory system. It has physiological condition. Therefore, for candidiasis, we need some condition that lead to weakness and the candida change from normal flora to pathogenic form. Okay, we have three type of candidiasis in clinical manifestation: cutaneous candidiasis, mucosal candidiasis, and systemic candidiasis. Hope systemic candidiasis means split the infection and involvement the brain, the lung, GI tract, and urogenital system. That lead to septicemia, pneumonia, we sometimes see endocarditis and heart disorder. In cutaneous candidiasis, we have candida as a normal flora in a skin, in some area of skin, axilla, submammary in women, inguinal area, interdigital, and toe web in foot. You find this microorganism candida in this area. This area is interpterygo area. The part of skin that has fold interpterygo area. The interpterygo area, for example, interdigital space, axilla, groin, submammary, skin in submammary, and toe web. Sometimes cutaneous candidiasis involve interpterygo. For example, toe web. You must find lesion in toe web, in interdigital. You can see maceration of skin, wound, inflammation. In this condition, in interpterygo disease, you must not only attention to candidiasis, but also you must find and search dermatophytosis, as I explained before. Dermatophytosis can involve interpterygo skin. Candidiasis can involve this area. And in upper part of trunk, Tina versicolor. Tina versicolor. In axilla, you must search for Tina versicolor, candidiasis, and dermatophytosis. If you have a patient with disorder lesion in axilla, you must check for Tina versicolor, candidiasis, and dermatophytosis. And a bacterial infection, that name is erythrasma. I think Professor Dai explained for you in superficial mycosis. It is axillary area. In candidiasis, you can see the lesion of candidiasis in skin, especially in submammary, in groin, in axilla, is inflammation and redness, and satellite lesions, satellite rush, agmar in Arabic, I think satellite lesion, satellite rush around the main lesion, main region. In axilla, you must check for candidiasis, erythrasma, Tina versicolor, and dermatophytosis. Another picture, interdigital candidiasis, interpterygo candidiasis, cutaneous candidiasis. Maceration of skin, especially in women and the man that work in kitchen, and we have many wetty media that work. You work in wetty media. Inflammation, maceration, ulcer, may you can see, or in submammary, you find lesion like as axilla, main erythema, main lesion, and satellite rush, satellite lesion. Uh, One of most important, most number of frequency is interpterygo candidiasis in cutaneous candidiasis. Another, napkin candidiasis. Napkin candidiasis usually occur in infant, in around genital and around anal. You find erythema, satellite rush, and you must check it for candidiasis. Another form of cutaneous candidiasis you find in infant. onychomycosis, it is another type of cutaneous candidiasis. What is onychomycosis? What is onychomycosis? I explained before. You forget? In dermatophytosis, we explain it. Mido? Mido? The infection that infect nail. Onychomycosis. Onychomycosis is another shape, another type of cutaneous candidiasis. Sometimes the candida invade the nail in uh, children group and women show high rate of number in cutaneous in nail candidiasis. You find this clinical sign, change the nail from white color to black color based on the species of candida. Inflammation of soft tissue, inflammation and swelling of soft tissue, and destroy the nail. One of common uh, fungal agent for onychomycosis is candida. For diagnosis of candidiasis in this condition, you must have a laboratory report. Another type of mucosal candidiasis, is mucosal candidiasis. Means at first you have candida in epithelium or mucous membrane of organ, internal organ. At first, clinical sign is a whitish layer. For example, in oral cavity, in urogenital, in vagina, in women. That name is thrush. Thrush is a whitish layer, usually in oral cavity, in baby, in some adult with A vitamins, with A vitamins, with HIV, with AIDS, with person that use denture, artificial teeth. It lead to mucosal candidiasis. In mucosal candidiasis, you find whitish layer, whitish pseudomembrane layer, pseudomembrane layer. They are colonized of candida in surface or oral cavity. Sometimes it is very uh, long and in form of chronic. It remain and the treatment is very difficult, especially in AIDS. You find this form of oral candidiasis. Yes, yes, yes. It is painful and uh, destroy the papillary, and there isn't any weight. Or in this case, it is a whitish or in this area. In in mucosal candidiasis usually affect oral cavity. Sometimes it vagina in women, vaginitis or vulvovaginitis in women, and balanitis in men. It is a contagious infection. Uh, for diagnosis of candidiasis, you use the clinical sign, but you must refer the patient to laboratory. In laboratory, based on the location of infection, you must prepare the sample. The sample may in cutaneous, may skin scrap, or in nail infection, nail scrap must prepare. Vaginal discharge, oral cavity specimen. In systemic mycosis, may you prepare the blood and check the blood. In respiratory infection, you must check the sputum and BAL. Do you know BAL? Ball. BAL. Ball. It is broncho alveolar lavage. BAL. That with bronchoscopy report and transfer to laboratory. BAL. BAL is very important for mycology in systemic infection because usually you have patient with respiratory disorder, respiratory disease. BAL is very important. Blood and CSF in cerebral infection. Sometimes in systemic infection, especially in HIV, may you have brain infection. Therefore, you must check CSF. Or in diabetes. In diabetes, you must check CSF when we have brain infection. In laboratory, we must check the specimen with KOH for what? Direct max examination, KOH or grammacy for what? For finding the pseudohive and blastospores. This one, and this one. CSF or tissue material in oral cavity, vaginal discharge, nail disorder. If you find this element in this fungal element, the diagnosis is candidiasis and report to physician for treatment. In candidiasis, for detection uh, the species of candida, you must culture a specimen. Culture on SC, Saburovid chloramphenicol. In culture, you find the colony. No, the best way for identification the species of candida is PCR, polymerase chain reaction, molecular approach. With molecular approach, with molecular method, you can decide for the species of Candida. Now, in uh, about 10 years ago, there isn't any molecular method for detection and identify the species. In that years, we use media, some tests, some physiological tests, some biochemical tests for identify with high uh, false uh, answer and false uh, identification. But now the best way for identify a species of Candida is molecular way PCR. After uh, after diagnosis, we must treatment the infection based on the location. Yeah? Yes, based on the location of infection, you must decide for treatment. What mean based on location? Yes. Uh, if you have nail disorder, you must topical treatment. If you have oral candidiasis, you must use systemic treatment. If you have urogenital infection or respiratory infection, you must use systemic treatment. It is in relation to anatomic site of infection. In oral treatment, we use uh, locally, in addition systemic. When you use tablet, it is orally and affect in oral cavity lesion. For treatment of candidiasis, the nystatin is selective drug. For some part of infection, some part of lesion that you can use. For example, you can use nystatin in oral cavity or as a suspension form, or use nystatin cream in uh, skin lesion in axillary. But because this antifungal drug cannot GI absorption, you cannot use this drug for treatment of respiratory system, of the other internal organ or brain infection, because there isn't absorption of nystatin in GI tract. One question: uh, can we use nystatin for treatment of duodenal infection by Candida or GI tract infection, except oral? For example, in stomach, in intestine, can we use nystatin? It it hasn't GI tract absorption. In this condition, can we use this drug, this nystatin, for treatment of the duodenal infection? Why not? Maybe no. You need absorption the antifungal drug that it reach to brain, it reach to lung. But for GI tract, you haven't need to absorption. You you can use this drug directly. Any there isn't any absorption, but it can affect on internal intestinal disorder. It can affect. Therefore, for treatment of GI tract, you can use nystatin, but you cannot use this nystatin for treatment of brain infection, respiratory infection, because there isn't any GI tract absorption. Therefore, in this condition, we can use another another drug like as amphoby. Amphoby is a general treatment for all systemic infection, all systemic. But because it has side effect, we can use at least those, and use another drug like as azole, or in candidiasis caspofungin as a new antifungal drug. In liver side effects and kidney. Azole may you use instead of nystatin from azole, miconazole, fluconazole, clotrimazole in skin infection, and orally miconazole, fluconazole in systemic infection. Based on the reaction the patient to healing, you must control and check the protocol of treatment. It needs uh, generally treatment of systemic mycosis need to managing of and control of treatment. It is not simple. You must check the patient. In summary, candidiasis is a fungal infection caused by the yeast candida, especially candida albicans. Candida normally, as a normal flora, exists in skin, in mucous membrane, and when we have predisposing factor, it change from normal flora to pathogenic form. For additional information, you can refer to this reference.